In 1932, a 30-year-old cotton farmer named Herman Shaw received a flyer. He lived in Macon County, Alabama, a rural community of mostly black sharecroppers working land they didn't own for wages that barely covered survival. The flyer offered what seemed like a miracle. The United States government was coming to town to provide free medical care. But the U.S. Public Health Service wasn't there to heal anyone. They had secretly enrolled 399 black men suffering from syphilis into an observational study. The researchers never told the men they had the disease. Instead, they told them they were being treated for bad blood, a vague local term used to describe everything from fatigue to anemia. 15 years into this study, medicine took a massive leap forward. By 1947, penicillin was established, mass-produced, and distributed as the absolute definitive cure for syphilis. The researchers now faced a choice. Administering penicillin would instantly cure the men. That giving them the cure would put a hard stop to the experiment and nullify 15 years of observational data on how untreated syphilis destroys the human body. The government directors ran the numbers and made their decision. The dataset was worth more to them than the lives of 399 citizens. This decision officially transformed a passive observational study into an active, malicious cover-up. With a known cure easily available at clinics across the country, the Public Health Service had a logistical problem. They had to keep their test subjects compliant, entirely unaware of penicillin, and away from real doctors. Researchers maintained a theatrical performance of medicine to keep the men in the program. Doctors continued to draw blood and perform examinations, dispensing aspirin and vitamins disguised as cutting-edge treatments to trick the men into believing they were being healed. But the outbreak of World War II presented a massive threat to the experiment. Many of the men in Macon County were drafted. If they were conscripted into service, military doctors would automatically screen them for syphilis and immediately cure them with penicillin. To stop the cure, the researchers turned to bureaucratic sabotage. The study directors collaborated with local draft boards in Alabama, cross-referencing their subjects and instructing the boards to pull those specific names from the military induction lists. By blocking their draft status, the researchers effectively walled these men off from the military healthcare system. They built a bureaucratic fence around Macon County to ensure the cure could not reach them. These targeted deletions from the draft represent a calculated operation to keep American citizens infected. While the public health officials maintained this cover-up in Alabama, a very different scene was playing out on the global stage. In late 1946, the Nuremberg trials began. American prosecutors argued that conducting medical experiments on human beings without their consent was a crime against humanity. The U.S. government was prosecuting Nazi doctors for human experimentation, while simultaneously running a non-consensual medical experiment on its own soil. This contradiction continued undisturbed until 1966, when a venereal disease investigator named Peter Buxton read the Tuskegee files. Horrified by what he found, Buxton filed a formal ethical protest with his superiors. The Public Health Service met his protests with institutional silence. A committee of senior officials reviewed the files and mandated the study continue until all participants died and could be autopsied, burying Buxton's reports for 6 years. This committee-level decision established the experiment as a protected, multi-generational mandate of the federal government. The experiment only ended in 1972 because Peter Buxton bypassed official channels and leaked the files to an Associated Press journalist. The 40-year deception left a trail of preventable destruction. 28 men died directly from syphilis, and 100 more from complications. The disease had spread from the subjects to at least 40 wives, and 19 children were born with congenital syphilis. Facing public outrage, the government offered a $10 million out-of-court settlement to the survivors and their heirs, but the institution remained insulated. Not a single researcher or official was ever criminally charged. It took another 25 years for the state to issue an official acknowledgement. In 1997, President Bill Clinton invited the few remaining survivors to the White House to issue a formal presidential apology. The financial payout failed to address the structural damage done to the community's trust in the medical system. We can track the exact cost of that broken trust. Researchers at Stanford Health Policy analyzed the long-term, generational aftermath in the years following the 1972 disclosure. This chart maps older Black men's life expectancy. At the 1972 axis, when the Tuskegee story breaks, there is a sharp, measurable drop. This widening gap illustrates deep medical mistrust. Communities avoided doctors after seeing documentary proof of state-sponsored deception. That mistrust compounded across generations. During the COVID-19 pandemic, public health officials identified the legacy of Tuskegee as a primary driver of vaccine hesitancy. The U.S. government successfully hid a cure in the 1940s, but the resulting mistrust became a permanent, lethal contagion. It is still costing citizens their lives today.